last class we did fistulas, right? So it's everything about AV fistulas. Just now, let me type it up one time as I'm speaking. Right? Everything about AV fistulas, everything about AV grafts. Let me see. I have a, right. Let me see AV detail formation and use. I've shared videos fistula in complete detail. So it is the in complete detail, right? So everything about AV fistulas and AV grafts, right? Then it's the same thing, right? The complete detail of catheters. When I say complete detail of catheters, including advantages and disadvantages. Advantages and the disadvantages. Right? A full detail of renal transplantation.
Miss Ticket, just repeat that, please.
I'm typing it in the chat, darling.
Okay.
You all seeing what I type in here?
Yeah, miss.
Yeah. Right. Right. Let me see. Discuss briefly how concerning movement by okay. Our fistulas cleared. So how are fistulas cleared? Anybody? From thrombosis and stuff like this. What is thrombosis? Everybody hearing me?
Blood
Yeah.
clot.
Right. So how are fistulas cleared from thrombosis? Now all these things that I type in here, it's sure coming in. I'm feeling sorry for all you. Normally I know I stop help long time in these situations. Right. So how are fistulas cleared from thrombosis? Explain. But that's not the that's not the answer that I'm looking for, right?
Miss, that's when
But
you use a catheter to access the clots and
not a
remove it or break it
catheter,
up.
but and what is the name of that process?
Is it the heparin thing?
No, it is not heparin. Heparin. Oh my. No, no. Let me get this clear, right? Heparin does not melt clots. And I see big old dialysis technicians saying that strappiness. Heparin does not melt clots. Heparin prevents clotting. And when Dr. Michael tell you all, he will tell you all the same thing. So I'm sure I'm not crazy, right? Heparin does not melt clots. Just get that in your head. Heparin does not melt clots, right? I'm looking for a particular word. What is the procedure called in removing this clot, this thrombosis from the fistula? No,
Angioplasty, miss.
no. Fistuloplasty.
Oh,
So, so you all wasn't taught that?
No.
I did not. I
No.
don't.
Okay,
I
so
have it written, but I didn't pay attention much to
you need to
it.
pay attention to it because that is
Yeah.
in like disadvantages of having a fistula, right? Um, that is part of a disadvantage of having a fistula because you get thrombosis. So when a patient have a thrombosis, they have to go do a fistuloplasty, right? If you look it up, you see a fistuloplasty is a minimally invasive procedure to open blocked or narrowed blood vessels in an arteriovenous fistula. So this is why I was asking, what is the name of the procedure to clear that thrombosis or that clot, right? And you need to know how this works. So the fistuloplasty, right? Yes, they insert something like a catheter with a balloon into the part of the fistula that gets narrowed, right? And then they inflate this balloon. So it's like you widen back the space, just like how there's was stent in the heart. Understand?
Yeah, miss.
I
Yes,
literally
ma'am.
think about to watch a video about it. Just to see if I get a short thing about it because no, there's something, you know. I didn't fistuloplasty procedure, right? Okay, let me see. Just give me 1 minute. Let me get to share this. By the way, you all can look it up. Um,
Hmm? Okay. Yeah, go on. Hard like go on.
okay, everybody seeing what I have on the screen here?
Yes,
Yeah,
ma'am.
miss.
Okay, so I just
Yes,
want you all to
ma'am.
just watch this quick video so that you all could understand because I just want you to know, make sure that you all see it. You all hearing everything too, right?
Mm-hmm. I hear yeah.
I'm not hearing.
Miss, your audio isn't
Why?
sharing.
Okay, let me see.
And I think
Mm-hmm.
someone is in the waiting room.
You all hearing it, right?
No, miss.
No,
Oh my
miss.
God.
Mm-hmm.
Okay.
Mm-hmm. Mm-hmm.
You all hearing?
No.
Nope.
Okay, so I'm just okay. I'm going to share the link in the chat because this will be very helpful, right? For everybody.
Okay.
You might get a little 5 marks, who knows?
I mean,
Hi,
5 and
Miss
you
Sarah. Good
eleven.
afternoon.
Good afternoon.
When your class finish, can I have a moment of your time, please?
Always, no problem, Miss Walters.
Thank you.
You're welcome.
Good evening, Miss.
Good evening. I saw your essay, Miss Rose. You sent me from a different number.
No, I didn't send you anything. I will send it after class.
Okay, so then I have the wrong person. Yes. I swear I got an
Miss, that's
essay.
me, Roseanne.
Roseanne, yes, it
Yeah.
was a beautiful essay. Yes. Well, I see that you had all the graphs and advantages and disadvantages, right? The reason why I said essay is because you know that you have to put all together, right? But when coming to the graph, you put everything together within your essay, and then with the fistula, they does the same thing, and with the catheters, they do the same thing also. Okay, Rosa?
Okay, Miss, thanks.
They put everything together on topic. Okay, so I send the link for the video, right, in the tutorial chat. So renal transplantations. You all haven't did that well. You all need to go through this handout and know everything about renal transplantation. So that's 1, 2, 3, 4, 5. So tell me if you all agree or if you all disagree, right? I'm just going to throw out some quick questions. A disadvantage of the AV graph is that the graph material, your body don't have to accept it.
True.
Mm-hmm.
Blue thumb, red thumb. That's for grafts or fistulas?
Crafts.
Nice.
Miss,
Just
could
hold
you
on a
repeat the
minute and yes,
question?
blue thumb and red thumb. Is it for grafts or fistulas?
Gluten, right?
Miss, what was the first question?
Um,
It's for graphs.
the first question, just now. I can't even have to look back this time. Somebody could say what was the first question I just asked?
About the AV fistula. If it is if it is rejected by something like that.
So if the graph, I
Material in
asked,
the graph.
yeah, I asked if your body will reject the graft material.
Right, I see. True.
True.
In an emergency, you could use a graft within 2 weeks of the implantation.
Yes.
Yes,
Yes,
true.
miss.
Usually 3 6s.
Excuse?
No, these pictures is for fistulas.
Yes. Physics is a fistula.
One
Right?
is 2 weeks, is 2 to 3 months.
The graft
is
is 2 weeks and the fistula is
6
right.
6
2
I
to
have a
3.
patient. I had a patient. He went in and he did the graft this morning, and he come for dialysis. And he said the doctor said you could dialyze me. I never see that yet. And our head tech stuck him. He answered up big. Yeah. So yes, it's 2 weeks after, right?
Right, from week.
So
You only
end
saw
to end is the most common method to use for the creation of fistulas.
No,
No, it has
no, miss.
two
And
No.
they no
it has
longer use that much.
Yes
Mm-hmm.
or no?
No.
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 So what is the most common method that is used?
Side to side
Or
and
enterside.
Or anticide?
And
Side.
side?
to side.
Yes. Yes. So if a patient have real bad rigors mean or chills, right? Real bad chills. They come in and you put them on the machine and they're trembling real bad. That mean you could continue dialyzing them like normal and nothing happen.
no, you have
No,
to
miss.
No.
They have a
do
catheter. There's a catheter
hemodialysis.
patient.
Is
So
that I
Infection,
think
You
it's a
have
miss?
to
sign of
return the
infection.
patient
yes,
blood and stop dialysis and refer them. So you have to, it means
nice.
an infection.
Yes, right. Um. So after putting in a fistula, is it recommended to exercise the arm by squeezing anything, or you're not supposed to use your
No.
hand at all? You're supposed to have your hand at
Yes,
complete
miss. You
rest.
could squeeze the
Yes,
stress
it is
ball.
recommended.
Right, yes, you can squeeze. Mm-hmm. Yes.
Oh, I thought you're supposed to rest your hand.
But you have a ball, I read about
If
it.
you have
Yes,
a
you can
ball, yeah,
squeeze.
miss. They say how even
Yes.
before they do the surgery, you could
Before
start
and after,
Yes, you
exercising with
start
the
to
arm.
exercise the
help
hand
you
by
out
squeezing
with
the
your
ball. Yes. Dacron is the material that is used for AV graft. Is it?
No, miss.
So what is the
no.
material that is used for AV graft?
Bovine, treated bovine vein or polyuterine,
The
and
polyuterine.
PTFE,
PTFE.
PTFE.
Polly. Sure. I can't pronounce,
Polytetra.
I can't pronounce it.
Yes,
I have it written down though.
yes, PTFE. Right? Try learning the word, please. Thank you.
Right, PTF, polyuterine, and polyuterine.
So a graft is the best vascular access that you can have ever.
No, miss.
No.
So what is the best vascular access to choose?
A AV
The
festival.
fistula.
Fistula. Then you could put a graft and the catheter, the Gabriel infection, and it's
Yes.
for sure.
Yes. Let me see. So a patient with a catheter that has an infection, what type of blood test is done? What do they call it?
What?
Is B and
A
C.
patient with a catheter that has an infection, what is the blood test that is done? What do they call it? Doing what? Doing what? Blood something. I helping a lady, blood
Blood
something.
cultures.
Yes. So you do blood cultures to see what it is. Majority of the time you see sepsis and all kind of things. You see sepsis, you see Staphylococcus aureus. Now when you see Staphylococcus aureus, this is from not wearing mask, right? And or having your having your catheter open. That's why even when you're doing dressings, you cover the patient catheter at all times, that opening site, right? And you tell the patient to always keep on the mask during treatment, especially if that area is open, because just by you breathing is germs. You understand? That's why I also continue to change your gloves and stuff like that.
Yes, okay, being there. Mhm.
Um, if a patient is on dialysis, right? And they have a catheter and the hand start to swell up. That means what? What does that mean? If a patient with a catheter, subclavian catheter to be precise, if the hand start to swell, what I mean?
It's
Yeah,
an
I check maybe
infection.
No,
Thrombosis.
no, yes, yes. Who said
Epiduria or something.
the person who said thrombosis? Yes, it has a it means that it has a clot in the vein. Yes. So thrombosis is a correct answer, right? It means that one it's like, okay, so a patient, you see a patient with after they have a subclavian. Which one is the subclavian? Again, the neck?
No, you want on the chest.
Oh, okay. I was just making sure.
Excuse me,
Right?
miss.
Yes?
And also a subclavian catheter is also called a perm cat.
Yes.
Okay.
Why?
I just wanted to find out.
Well, why? Why did I call it a perm cat?
Because
Because of the cuff, right?
yeah.
Nice. So we're going to that in a few. Um, the saphenous vein in the leg, that is used for the creation of fistula.
Sophia's vein in the
In what
leg.
vein?
Saphenous.
I think
No.
so.
I don't know. I'll have to find the answer and tell me because I asked the question. Elaine asked me. I asked him, Elaine.
Miss, if it is used for what?
For the creation of an AV fistula.
No, miss, it
I
is
know
not
the
used. I never.
neck, chest, and voice, Sophian vein, jugular vein in your neck.
Which part in your leg that vein is, Sarah? Which part in your leg that vein is?
I don't know. Just now. I was
The
just
inner
asking the
side of
question.
your
Is it
thigh.
is yes or no? How much people agree and
No,
how
and I
much
want to
people
know
don't agree?
which part
No,
in the leg the
No, but
vein is because
no, that vein isn't used
Oh,
for
that vein
fistula
isn't used.
because a fistula is made for a upper arm or a lower arm in a less dominant hand.
yeah, but I know that there is the graft in the leg. So it is used. It have so what is the leg graft called?
leg graft.
Yes, it have a graft in the leg.
Lower groin by the lower groin or somewhere.
Femoral,
femoral,
Femoral is catheter.
yes.
femoral.
Oh shoot, yeah. Shoot. Sorry.
Miss, good night.
What's the question?
I'm seeing something here about a femoral saphenous AV fistula. Um,
Nice.
the femoral artery I could surgically connect it to the how to pronounce it? Something vein. I can't
The
pronounce.
femoral vein, the
Saphenous,
saphenous vein or the femoral
saphenous
vein.
vein. Right.
Yes.
Yes. Superior vein
So
or
that is
femoral.
transpose. So what it does do is that it transpose it, right? So it can be used for the fistula or the grafts. But sorry, for the grafts, sorry. There's more used for the grafts. Sorry, the upper thigh graft. With the saphenous vein, right? So it is a saphenous vein loop graft is what it is called. So the saphenous vein is not used for fistulas, it does be used for the graft, right? So it doesn't do fistulas in the leg, it is used to do the graft in the leg, right?
Miss, it
To
has to
those
be
get that.
transposed, you said?
Yes, there is transpose. If it hide,
Okay.
and you know the transpose just mean that they pull it out so it could be better to connect, because remember when you're doing the graft they're using the PTFE.
The material is the PTF.
Yes.
PLYTETRA
Polytetrafluoroethylene. Just 1 minute, please. So you all got it? Look it up. The Seraphina's graph.
Seraphina's
Read it
graph.
now.
Spell that word.
It's only Google, not Google, only Zoom chat.
Where is that?
It's only Zoom chat. Just have vein graph.
Remember, I was telling you guys last week about how I had a patient, the same patient who I was saying that she had the osteomalacia and the bone started to break up. So she had a graft in one hand, then they went and do a graft in the next hand because then the two hands broke, and then she went to do one in her leg, and by the next week she was there. I think I tell that story plenty times. So yes, the saphenous is used for the grafts, right? Not fistulas. It was just a matter of you all not getting
Well, it filled my belly good. I eat all and I was hungry.
Miss Empire, could I share? You know, you might on. Okay, so let me see. You all went through this. You all went through that diet full. At all. Yes. I am joining them. I saw the person in the
We
diet
just get up
full.
today.
What diet folder, Sarah? The 66 pages. What I
Oh
sent
God,
today?
Tiffany, it is a diet full because that 66 pages could never be a handout.
Miss
Miss,
is
we just get up
because
today.
of our
I
other
know.
textbook, so well, admin had sent on the thing.
I'm feeling sorry for with that. But then,
James, what,
by
Sarah,
next
what
week
you're
Thursday, make
asking
sure I
us if
read
we
it.
went through the 66 pages renal diet handle thing that is sent today, that?
Yes.
Yeah.
I forget to send today.
Sarah.
Hi,
Since
good
last week, I
afternoon.
was
Good
I was
afternoon,
telling them
everybody.
to send it even with the
Good
renal
afternoon.
transplantation handout because I'll come. Who looking for me? Yes, since last week I told they send the renal transplantation handout for
Sorry,
you
good
guys because
afternoon.
good evening, Andre. Because you all that is a big topic. What happened
Sarah,
now?
sorry for interrupting.
This is
Yeah.
I just
madness.
came in, but what I just heard, I went to Miss Gray about this, and I told Miss Gray they cannot be sending handouts a day or two just before and expect us to
Agreed.
go through it. I told her
Agreed.
that, and she told me she was of the opinion that we were getting it by the Monday. I said, no, that does not happen. And here it is. They send us. I starting to feel like that we are being placed in a position to fail. As I told her, I don't mind if I go through this entire course. I try my best and I fail because I was either slack or I didn't retain the work. But if it is these things are being done by the organization, it putting me under a grind. There's 3 jobs I work in to make sure and pay, right?
I totally agree with you, Mr. Dugan.
And when I come up and I say things, people they don't like how I just talk, but all you're putting us at a disadvantage. And how you expect me to pass?
No, I totally agree, and as I saying, that is why I here to help. And for the
9
sake,
a.m. in the morning, all this and that.
I really and truly helping on it for this exam, because you know normally I am giving no questions and things, so I stopped that
Well,
long
Sarah,
time.
you can help us further by letting Dr. Michael know. You see that 66-page thing where they sent today? I have a problem with that, so better you don't give me nothing on that.
Tiffany, okay. Every course it does have the 66-page handout. That's why I laugh, because I went through it too, but the
Yeah, but I'm sure you never get it today for tomorrow.
Sarah,
I'm just saying.
Sarah,
yes,
people in
That is
this
madness.
program, a lot of people staying silent. I don't want to stay silent. I just talk my mind. We all do research and we all know people from the previous courses. And this is something that they already have on their system. So why are we getting it a day or 2 before? Is it deliberately done to set us up to fail? That is what is going through my mind.
Oh, honestly, I thought you all received it since last week, because that was my whole thoughts. Even when I asked about the renal transplantation, somebody told me you all did renal transplantation last week. So I was
Sarah,
asking about the
we did it
handouts.
from the book.
We did it
Sarah,
but we did
Sarah,
not get our
totally,
handout until today.
I am totally
We get
shocked
the
now that you're
handout
saying that.
after
Because
you're
when
done
I had
doing.
a meeting, you see, when I got bumped out of the online, which was what, last week or no, week before, I came to the school and I had a discussion with Miss Gray, right? And I told Miss Gray, it is unfair for me to get bumped off. She said, well, here what? You could go through the recording when they send it to you on Monday. I said, what recording? I said, ma'am, we don't get any recordings by the Monday. She said, but if she doesn't know and you don't know, come on, we are being set up to fail. That is, Dr. Michael argued with us the other day and said, oh, I don't read this already, read the 50-page handout. When we got that, you can't be doing that, people working, and you want us to pass. And on top of that, you're giving us the schoolwork to study, you're giving us the course to study, but the exam questions are so technical. It's as if we've been doing the practical application all the time. And he says he wants us to think. How could we think if we never do the practical application of things? Right? You don't want us to regurgitate. Just remember and write. You want me to understand. These are things you're giving full-time med students who come through the ranks, not people who now trying to get into it, but you're failing us. If it didn't come out how you come, you're failing people. So I am totally confused. I just ride in the train just like other people. That's how it come down to me, come on money spent. I disenchanted, totally disenchanted.
As I said, Mr. Dugan, I'm here to help, and yes, I know it is strenuous. So yeah, that 66-page handout.
66 pages, yes. 66 pages that they sent today.
I thought it have a timetable.
Okay, I will give you some.
Dietitian not supposed to be in this. Dietitian supposed to be the next set of topic.
Okay, give me 2 minutes. Let me see if I get rid of Dr. Michael.
Because
I know that. Let's come this exam.
Excuse me, Sarah. Even if we see
I could even try to see if I could beg for a little extra with Folly, but I know that that's not going to work because I tried already.
I saw the exam done set already, basically, because it's next week.
We get in the machine, and we get in the machine, the cleansing at the machine.
Supposed to once you didn't come.
Yeah, but
I told you all to just learn the table. The table is all you had to learn. What's okay. No, my handles doesn't have. Okay, okay, you see the handout where, okay, you rinse after every treatment, you acid clean every day, at the end of that one, that handout, that is the table you're learning. That's not hard. You just have to know what time to do, what time you're doing what. Chemical clean weekly, acid clean daily, heat clean daily. You
That
understand?
whole handle wasn't even explained properly. It wasn't even explained properly. That whole handout, it wasn't explained properly. The classroom we had on disinfectant, we cannot be doing exam and we not be getting the work on time. We are not doing it the way we're supposed to be doing it in classroom. You're telling us to study for the fistula and the graph and all of that, then disinfectant. Now we have that the diet handout to go through, and that is for next week. That's for next week. How are we going to get our exam on all these topics next week? And we didn't even go through half of the topics.
Yeah, we complaining.
They will get you.
Sarah, it's not that we don't want to do the work, honestly.
I know. It's
right?
really frustrating. It's frustrating
Because
me. Hold 1 minute.
everybody in classroom does try their best. Because if we wasn't trying our best, it would not be a problem. We would not be complaining. It's because we want to do good.
Applying the pressure. And they had to understand too that people do work, people coming from far. Like me, I come from Blantyre to San Fernando, and it's hard. We still have a personal life. But then the way it would look like, they're not really busy because at the end of the day, they're getting paid to do whatever. If all they pass, all they pass. If all they fail, try again, I guess. And that's how it is. That's how
And it's like a blame game. All you're getting is, I didn't know that was happening, so admin doing the own thing then.
Nobody never know nothing.
No, so admin alone, admin deciding when they sending the handouts.
And that's so crazy because we have a timetable. If all well, we're supposed to start a topic this week. Oh, for heaven's sake, then by at least the Saturday, send the handouts.
Yeah, but not all the time they sending the handouts to the
Right, but I'm sure Dr. Michael will be coordinating with them and letting them know, well, okay, we're going to start this topic, we're going to start that topic, then all you need to be on top of things and just send the thing, send it before. Plan all your thing and send it beforehand. Don't send nothing for people today for tomorrow. That's craziness.
I was shocked because I didn't even know we getting more handouts.
Well, this is it. When I sit down at work and I hear
everybody. So I will be discussing it with Dr. Michael. I have just spoke to him right now. He's in a meeting, right? And I will be discussing it with him. And tomorrow morning he will clarify everything for you guys. So please don't stress. Let us just deal with the matters at hand and try to get over this. If it is that you all are getting the diet, right? Examination on the diet, I am here to help and give you all questions. You all wanted is you all would like to have some questions and help with the questions, or we stop and argue about it. Just like just now.
We want the help.
Yes, we want the help, but we also have to voice our opinion as well because
yes, but I don't want to stress
to voice our opinion. So Miss you sounding like what? Yeah, all thing, but anyway, take it, you still have to get it done, like it's or not. That's how you sound to me right now. But we all want to pass the exam. But it is a lot. It is a lot. So people voicing their opinion now, I would just say allow them to.
Yes, but that's not how I want you all to feel, right? I just want you to know that even if you're getting it for exam, I will help you go. I'm not talking about I will help just like how I normally help and say, well, right, I say ting. That right? I will help with questions.
Miss Excuse,
Yes.
I have a
Good
question.
evening. Good evening,
Good
yes.
evening. Good evening, sorry. On the maintenance schedule, right? The table you tell us to learn. On page 26, we are seeing some X's, but you cannot determine whether it's daily, weekly, or monthly because it line up there, but it have no writing to the top. I don't know if you can help me.
Just now I have a disinfection maintenance handout.
Mm-hmm.
And it have everything just now. This is the amount of handouts I have. This is what this school sent you all, and
Yeah. So disinfectant concentrate containers. It just have a X. So we don't know if it's weekly, daily, or
yes, it's
monthly
supposed to be
because
from the top. Just now.
no, it went on to the next page, right? So it had to tell. I don't know if anybody else figured it out, but
Page 29 with the procedure, rents, and how frequency, and the description and everything. And acid
Okay.
clean. I don't know if that is the table, but that's what I see here.
Yeah,
the
just now
table
I'll
I'm
get
talking
in
about
it.
is the routine maintenance schedule. That's on page 25. And then the rest of it go on to page 26. Chemical dwell, disinfectant concentrate containers, bleach clean, inlet water line.
Oh my, so just now I don't think I have that here. I'm looking. I supposed to have it.
All right,
Are we
well, probably you
learning
can take a
table
picture.
29 that says
I
cleaning
don't
and
have your
disinfection
handout.
recommended frequency?
No, this is after table 30, not table 29. It's the last two pages in the handout.
We don't need to learn that. I don't think so because the only
I don't
one
think
so
so
that
either.
and stuff like that. So I don't think that is part of it.
But I just think it's just the
What?
normal
But my table, what says routine maintenance schedule, it shows X and it tells you per and it says daily,
yes, which
weekly,
one
and
to
it have
do.
the X by each for me.
Yeah, but
But that's the table that I am speaking about.
yeah, but what I'm saying, we seeing it line up till chemical rents, but when you turn the other page, the
What is the
X's
name of that
become
handout?
peritoneal dialysis and disinfection and maintenance.
Right, peritoneal
Miss, I'll take a
dialysis.
picture of mine and I'll send it for you.
Okay, no problem. I know that
Yeah.
wasn't quite in that last thing because I do have it.
Okay, thanks.
So when you all get that big, the next 66 page handout in the ending. Okay, right. So it have it have a handout here. With the rents is per unit protocol, exterior surface after every treatment, acid clean daily, heat disinfect daily, chemical rents weekly, chemical dwell per unit protocol, and bicarbonate jumps and suction caps weekly. But then it have one with the X. I'm going to send it in the chat. Yes, Rajwanti, that is it. Oh, I now see what you're talking about. Yes, but look at from the page before. I'm going to send my own for you all because it's branching over to the next page and I understand why it's confusing.
Okay, thanks.
I have a different handout. I have a compilation of handouts. So my handout is in a folder stuff. a binder, sorry. Okay, so I now send it in the chat. Did you all guys not get a handout looking like this? But this is the table. This is what I was talking about and said to learn with the X's. You don't have to use you don't have to learn the reference. You understand? Just which part to put the X, either by day, you understand, per mean treatment, then it's daily, weekly, monthly. Right? So that's what I'm speaking about.
This is the only table, right? Or the other one before? That's it.
Okay, Miss, thanks. I seen it clearer on yours. Thank you.
You're welcome. And it have the whole thing, you understand? It not break up into 2 pages or anything like that.
Yes, it's much clearer. I appreciate that. Thanks.
So that's how I thought you all had it. Okay. Yes, I saw Mr. Donovan. Yes, I am joining him. I was looking for the page here, so that's how I wasn't on my computer because, can't do 3 things at the same time. So those that joined late, in the chat has all the topics that would be coming, right? We also went through some small questions. Okay, so anybody has any other questions? I have a paper here that I will give just to... And the dietitian exam, if you are getting anything, it's multiple choice, eh? No, Miss Savitri, that is the only table that I will recommend.
Sarah, I have a question.
Yes.
For the AV fistulas, right? For the rule of 6. The rule of 6. Is it 6 rules it's supposed to have?
5.
Okay,
I only
just
see
5 rules.
5.
But that is it I want to know because I
Yes.
only see
You don't
5
have
too.
to.
So they just call it the rule of
is
6 because
everything
of the fact that it had to be 6 millimeters diameter, 6 millimeters, less
correct.
than 6 millimeters. Okay, got it. Thanks.
Yes. I think Shania sent the rule of 6s in the chat last week. The rule of 6s, a mature fistula should be greater than 6 mm in diameter, be less than 6 mm below the skin, at least 6 centimeters of vein length for cannulation, have a good flow greater than 600 ml per minute, and be evaluated for non-maturation at 6 weeks after surgery. Everybody got that? It was sent in the group, so let me send it over.
Yeah, no, but we have it in a handout from Dr. Lucian, though.
Yes, this was sent from the handout, but I just sent it for the ones who missed it.
Okay.
Excuse
Oh my
Sarah,
God.
you said
Yes.
what it is you covered is in the chat, this chat or the WhatsApp chat?
Yes, this chat.
I'm not able to see anything on my end though.
Okay.
Only what Savitri saying.
Okay,
Message.
so what I said that. Okay, so let me ask a question, right? Anybody has ever been bumped off, and when they're trying to get back in, they got a message stating that you are unable to rejoin this meeting because you were previously removed by the host?
No.
That was me.
Apparently, yes.
That was me.
A student got this today, and I told her I didn't remove her. So apparently, like, she didn't
The
join using
school,
her name or
the
something like that,
school
and she
have
cannot
been,
even come back in the meeting, and I don't know how to get her back in the meeting.
Miss, the school have been removing persons because of payment. So probably that's the issue there.
Oh,
Which I still find is unfair, but although it's not my business, but it have people really trying here and applying themselves to do the work. So persons that not in class is sometimes is because of payment.
okay, I understand. Okay, so for the person that missed the topics, right? I said everything in complete detail about AV grafts, AV fistulas, and catheters, including the advantages and disadvantages, right? I said that full detail of renal
Just now, 1 minute.
transplantation.
I write it just now.
Oh, Miss Tusa, you now join. That's why I missed it.
Yeah, I worked
No,
10
no,
to 6 today, so I know able to join.
It's not in the chat though, miss.
It's on the chat here. It's not on the chat on WhatsApp.
No, it's not on the chat here. There's main chat. I'm not seeing it though. And I joined since early.
It come
Yeah,
off.
it's not on the main chat. Yeah, you had said that you was going to send it on the main chat on Zoom, and you didn't send it as yet.
Yes, I sent it.
No,
It is
I see it.
here.
Yeah, yeah, I
It's
see
here.
it.
I
Yeah,
was the first person to type in the chat. It is here because that's where I'm reading it from.
I am
I'm
not
going to
seeing
take
it.
out a picture of it, right, and send
Please
it in
don't
the
miss.
dialysis chat because it is here.
Okay.
I screenshot it and I sent it back in this main chat for who missed it.
Thank you very much.
Thank you
No
very much,
problem.
Tiffany.
And I'm sending it in the dialysis chat. Right, and then I said in full detail renal transplantation. So I advise that you all, and that would how our fistula is cleared. It's not supposed to be from, it's supposed to be from thrombosis. Right? Ooh. Any questions, anybody?
What about diagrams?
No.
Okay, cool.
Yeah, I wish I looking at the diagrams.
Nice to be getting disinfection, maintenance.
Excuse?
Yeah, that's
Disinfection and
fine.
maintenance at the dialysis
The
machine.
table, the table.
Okay then.
Yeah, but that's basically it. Once you have everything about graft, fistulas, and catheters, you're not supposed to have a problem. At least you know right there like 30 marks, 30 to 35 marks. Then you have a little 10 marks with your multiple choice. Well, your true or false or whatnot. Renal transplantation, you have to go through that. I really want that you all just got that handout today. So what are the different types of grafts? Yes, Mr. Donovan, you wasn't here all along. I heard the sad news that handouts came this morning, and it would be recommended that you look up your read through your dietitian handout. But as I said, I told you yourself, class, that I will be helping you guys with those questions for the dietitian class. Hopefully nobody go and says, Sarah give them all the questions for exam.
I doubt they will say anything this time, miss.
Yeah.
I highly
Again.
doubt. All you know snitching, you know.
Again. So, okay, it's 7 o'clock. So, anybody has any questions?
You're giving us the thing for the dietitian
Next week Thursday.
next week Thursday.
Because you all have to go to the dietitian lady first.
Okay.
But she's supposed to become. This is why I called Dr. Michael to ask. Because he said usually, she coming in. And everything that she speak about, it does come. Hello, Mala.
As the most I could say, right? Let me just read up on the handouts and maybe I might have some questions
You all
next
just
week.
hold on a minute, please. Okay, guys. So anybody want to read catheters or tell me about catheters?
Miss, excuse, what time this class finishing?
As long as nobody has a question or any questions, class could be over. All now.
Miss,
It
but how much
depends on your
questions people
questions.
already have? We have the new handouts on them to read. So, I mean, I like talking for myself. I don't have much questions to ask because I have to read the handout and try to understand it first, and then I could ask questions.
We want to know about the catheters, Miss.
Okay, no, I was just
Oh.
asking if you were clear about the catheters, right? So if anybody had any problems, because it's the tables, they're the advantages, disadvantages, right? If anybody need help, you all can message me. Yes, I know you all have to go ahead and go to read your handouts, so no problem, right? Because it's a whole lot, right? By 8 o'clock, I should get you Dr. Michael, because they said that he was in a meeting and that's why he couldn't speak to me. But I want to clarify this with you, and I know it's really hard and tough on you guys, but I try my best to help you all as much as possible, because you need the dietitian to come in order to do the diet exam. If the dietitian not coming in, well, then you cannot have any diet exam, because Dr. Michael is not the one that will teach diet. Okay?
Okay, miss.
Okay, so everybody enjoy your night.
You too.
Okay, same to you.
Night.
Okay, bye.
Bye. Good night, everyone.
Bye, Miss.
Thanks, Miss.
Bye.
Thanks, Miss.